I guess
This is Paolo, 25 years old, had a seizure on May 19, almost midnight. Fell on the ground, probably with two gashes at the lower back of his head. Went to emergency. Took 1.5 hours to of CPR in order for the heart to stay beating. According to emergency people, he did not have oxygen for about 10 minutes. Went to ICU, stayed there for about 2 weeks. A lot of throwing up, a lot of yawning with dislocated jaws, and then his upper teeth pushed one lower front tooth out and two lower teeth back. Eventually they had to be removed in order for those teeth not to be swallowed. He had a 10% ejection factor immediately after the emergency. A few days later he had total kidney failure, and he had 5 dialysis between May 19 and June 21, the day that he left for a rehab center. Paolo's eyes are in the irises are in the middle of her eyes. He has a G tube. He had trach from the first day on May 20 up to about June 15, up to about July of 2007. The only thing he has now is the G tube. In one of the pictures, you would see the 2 gashes at the back of his head. He had pneumonia. That's why he had a pulmonologist. He had an infection doctor, of course a kidney doctor, and a gastric doctor who performed at least 2 EGDs. One EGD with follow-through was done and nothing was found about it. He had 6 EEGs between while in the community hospital. He stayed there, as I said, between May 19 and June 21, and the 6 EEGs all resulted in low brain activity. Sometime 2 months in rehab, he had to go back for an EGD, and we took the opportunity to have a 7th EEG with another neurologist. And prior to the EEG, he did his own assessments, and many of those things were, according to him, typical of anoxic patients. The result of the EEG was, according to him, moderate to markedly abnormal. Comparing that to the 6th EEG, he said that was horrible. The 6th one had a horrible outcome. Paolo does not do any ADLs. There is every reason to believe, on my part, that he knows what's going on, except that he could not respond. Sometimes you ask him to do a long blink to signify yes. He will do that on many occasions, but not consistently. When you clap your hands, he will blink. Like right now. Well, That wasn't loud enough, I suppose. But anyway, he would do that. There was a time, according to my wife, and this was about a couple of months ago, for a stretch of about 3 months, that he would say, "Hi, Mom." And of course, it would not be that intelligible, but they figured it was "Hi, Mom." Right now, he doesn't say that anymore. It used to be that he, from time to time, would be able to switch one head to the other side if somebody was on the other side talking. You could see him initially take a look at you and stare at you, but it won't last. He has never been without any sedating drugs. All of those, which according to the physiatrist he wanted to see, but never was he without any sedating drugs. He has